Hello, welcome to Introduction to Pelvic Health for Women. My name is Christine Morgan and I am going to be presenting today. I am a licensed physical therapy assistant and also a licensed massage therapist, and I've been doing that for over 10 years, and I specialize in pelvic floor therapy since 2022. My overall goal for this presentation and our time together is to help to introduce or talk to you about your pelvic health and to answer any questions that you may have. I'm going to present some information, and then after that, I'm available for any questions. And I'm going to use this framework and ask about these things. Is it common? Is it normalized? And does it make it okay? So the top three reasons that women usually come to see me in physical therapy is number one is incontinence, and incontinence is the involuntary loss of urine or feces. Two is pain with sex, and third is prolapse. So take some time right now, write down some answers to these, or just mentally take a note. But here's some questions to think about for incontinence. Do you experiencing urgency when you need to pee? Do you experience leakage when sneezing, coughing, and or jumping? Do you experience constipation? And do you need to strain when you have a bowel movement? So if I put these three questions to this topic of incontinence, here's what I think about. Is it common? Yes. Urinary incontinence happens very frequently and can happen to 1 in 3 women. Fecal incontinence is also common, but a little bit less so, 1 in 20 women. Now, is it normalized? This I say is yes and no. Yes, I definitely can see women sitting around a table and talking about how they have lose a little bit of pee when they laugh or cough, or maybe they just had babies, and they'll definitely feel like that is pretty common. I don't see women doing that when they're talking about having a loss of feces. Does that make it okay? It's not okay for either of those instances, because it actually means that you may have pelvic floor dysfunction, and there's help for this. So what I think about is for next steps for incontinence for women is getting some education about good bathroom habits, having some pelvic floor relaxation and strengthening exercises and getting some feedback about that, and also vulvar habits. So just take a moment, write down any questions that you may have for me about incontinence, and we'll move to the next topic. So the questions I ask women when they come in with pelvic pain is, do you have chronic pelvic pain, and do you have pain with intercourse? And when I bring these three questions into this topic of pelvic pain, is it common? The rough estimates is 25% of women suffer with pelvic pain, and of those 25%, 90% will have pain with intercourse. Is it normalized? No. This one, women definitely, I feel, suffer alone, and it is very difficult for them to ask for help, even when they're talking to their doctors. And does that make it okay? Absolutely not, because there's help. Again, things I think about if you are thinking or having pelvic pain is pain awareness and pain management, menstrual cycle tracking, and working with your nervous system and your pelvic muscles. Take a moment, see if there's any questions that you have there. Prolapse. Questions I ask if women think they have prolapse. Do you experience heaviness of your vagina at the end of the day? And or have you felt a lump or a bulge in your vagina or rectum? Three questions again. Is it common? Less than 10% of women will report that they have a prolapse, but what research is showing is that far more actually do have a prolapse if a doctor examines them. Is it normalized? No. Women barely know that they have a prolapse, and they certainly are not sure what to do if they were diagnosed with a prolapse. And just so we have a definition, prolapse is the laxity of the vagina wall, which could happen from the front, the back, or the top. And we'll have a different name based on that. And does it make it okay? No. Again, there is help. And I think next steps are usually a pelvic examination, so you know what your prolapse is, and also education. Take your time. And the last questions and topic I have is about pelvic connection. Do you know your pelvic anatomy? And are you comfortable speaking about and advocating for your pelvis? Is it common? 40 million women annually suffer from pelvic floor issues that could be helped with pelvic education and or interventions, and they're not coming. Why is that? Because it's not normalized. There are many shames and myths and little education about pelvic floor issues. And does that make it okay? No. That is why I am here. So the next steps I think about for just this basic kind of pelvic education is start from your beginning. Don't worry about what everybody else is doing, and know it is a journey that you're going to go on. And if you need a place to begin, I think about practicing listening to your body. So thank you for listening to my presentation, and I am ready for anyone's questions.